Call the order. Please rise if you would and join me in the Pledge of Allegiance. Okay, under agenda review, I'd like to add approval of the manifests as an action item, if the board is okay with that. Thank you. Kathy, additions?
I have a photocopy lease, and that's an action item.
What is that? Photocopy.
Photocopy lease.
Photocopy lease, new copy machines as an action item.
And I have actually 3 more items. Senior activities, that's an informational item. Vaccinations, another informational item. And then the last day of school, informational.
Everyone okay with adding those to the agenda? Thank you. Those are mostly informational except for the copy machines, which will be an action item. Okay, next item on the agenda is acceptance of the minutes. First of the Academic Affairs Committee on April 5th. And the members that were present there were Krista, Tim, and Charlene, so I'd entertain a motion to approve that.
I'll make a motion to approve.
Second.
Okay, it's moved by Tim and seconded by Charlene. Okay, the 3 members, any errors or corrections, omissions on that? Okay, all those in favor of approving those minutes, signal by saying aye.
Aye.
Okay, that's unanimous. Thank you. Okay, the next item is the school board minutes of April 5th as well. Entertain a motion to approve those.
So moved. Second.
Moved by Dr. Jim, seconded by Tim. Roll call vote. Krista?
Yes.
Julianne?
Yes.
Tim?
Yes.
Wendy is not here. Dr. Jim?
Yes.
Jim Pittman?
Yes.
Charlene?
Yes.
And Dana?
Yes.
And chair votes aye as well. Okay, and the item that we added on was the manifests. The manifest being signed tonight. The accounts payable manifest total $2,584,990.51, and the payroll manifest being signed total $2,986,655.71, for a total of $5,571,646.22. Is there a motion to approve the manifest?
So moved. Second.
Moved by Tim, seconded by Dr. Jim. Roll call. Krista?
Yes.
Julianne?
Yes.
Tim?
Yes.
Dr. Jim?
Yes.
Jim Pittman?
Yes.
Charlene?
Yes.
Dana?
Yes.
And chair votes aye as well. Okay, moving on to the superintendent's reports.
The first item on the superintendent's report is just information about Teacher and Staff Appreciation Week. Something was sent out to teachers and staff, and I'll just read it for everyone. These past 14 months have been a challenge in so many ways for every person, family, and community. Yet, in service to our school community, you, meaning the teachers and staff, found a way beyond the fear, the exhaustion, and the unknown to take care of our students, their families, and one another. And this time last year, I thanked you for being such a tremendous example of how to rise in times of trouble and uncertainty, so the students would know you are here for them. You did it then, and you are still here for them now, stronger than ever. Throughout all this difficulty since last March, you have given the best of yourself to your community. Today and every day, on behalf of the Governor Wentworth Regional School District, I extend my deepest gratitude, wishing you all good health and the best of days ahead, and it's signed by Doc Widmer, but it's on behalf of the Governor Wentworth Regional School District School Board.
Thank you, Kathy.
Okay. Next item is summer school. I think at the last meeting I talked a little bit about initial summer school plans. The summer school plans have come along quite a bit since then. We've had some good preliminary registration. The numbers in the schools range between 40 and 50 students, and we understand that as summer gets closer, those numbers might not be as strong. I hope they stay strong, though. The program is for 5 hours per day, 4 days per week, for 5 weeks, beginning July 5th through August 6th. The program won't be just math and reading. It will also involve social studies and science. But along with that, there will be themes which will make things, I think, a lot more fun for the kids, and there'll be an opportunity for hands-on activities as well. So the themes that have been discussed thus far include nature, sea and space discovery, an artist in residence, possibly music and theater, carnival, and summer Olympics. So I'm really looking forward to seeing how the program shapes up, and thanks to Heather Cummings, Katie Hills, and the elementary principals for all the work that they've done on that. The next agenda item is the reopening plan revision. As you all know, since last March, we've seen many changes since COVID first came into our lives. We have certainly know a whole lot more about COVID now than we did last March. I expect that this new document that the board has taken a look at will be changing as our circumstances change and we're able to relax the mitigation strategies further. I do think that we're seeing a brighter light at the end of the tunnel these days, and I'm looking forward to being able to relax things a little bit more. But before I go into the most important aspects of the changes, I just wanted to thank our safety subcommittee, Cheryl Kravitsky, Tim Kelleher, Alex Drea, and Andrea Kessler for working to update the plan, and our COVID advisory committee for their help and feedback for this updated reopening plan, which we've renamed the Stay Open Plan because we're not reopening anymore. Our goal is to stay open. Board members, you've all received a copy, and I'm sure that you've had a chance to go over it. So I'll just highlight the most important changes. They're reflective of the things that we have learned along the way and implemented as we learned. The most significant change throughout the plan is the move from 6-foot to 3-foot social distancing. When the guidance on that changed, we immediately changed that within our schools. If you look at the document, some of the phone numbers were updated to reflect the more current phone numbers from the Department of Health and Human Services. All of the links to other documents were updated and checked to make sure that they still work and they still provide the information that we want them to provide. And as I said before, the reopening plan, since it was written in August, referred to what we were going to do. It's written now in the present tense, since it really reflects what we're currently doing. The contact tracing portion was changed. The school collaborates with the Department of Health and Human Services, but we actually do the contact tracing. I think DHHS initially had in mind that they would do the contact tracing, but given what was happening in the state at that time, it really wasn't feasible for them to do so. So they really relied on the school district for the schools to do that. And it was much quicker and more effective for us to do that research and give them the information. And that's the way we're still managing it. The restrictions have been loosened where they can be. For example, if a school were to close for a short period of time due to a staffing shortage, rather than due to COVID itself, after-school activities would still continue, which is not the way it was written in the original plan. Other than some wording changes for clarity, the most significant change is that the only travel that requires a 10-day quarantine is international or cruise travel. Also, those who are fully vaccinated and have passed the 14-day period or have been diagnosed COVID-19 positive within the last 90 days from the onset of symptoms or positive test results are exempt from quarantine. So that is a significant change. Field trips will be considered on a case-by-case basis. You know, although we would probably discourage field trips that go, say, for example, to the Museum of Science, where you have children from all over in close proximity, and you're staying overnight, and again, in close proximity, that probably wouldn't be a good way to start out our field trips. But we do have many field trips in the spring that start out outside. You know, Odeon Point, hiking, ropes courses, and those are all tied in with the curriculum. So the recommendation is that we look at field trips, or that I look at field trips on a case-by-case basis. Visitors to the schools remains the same, with anyone visiting to the schools expected to be symptom-free and follow the district guidelines. Early in the pandemic, we were advised that we should have a plan to close the school from 5 to 14 days for a case of COVID. We learned pretty quickly that we didn't need to do that, and we never closed for that period of time when we had a case. We did everything we could as cases arose to keep the schools open. So that was replaced with the statement, every attempt will be made to keep schools open full-time in person. Food service, students are 6 feet or more apart at lunchtime. Otherwise, the serving of meals remains the same. Most of the meals are packaged meals, or all of the meals are packaged meals. We hope to get back to serving the way we generally do, at the very least by the beginning of the next school year. We now know that surfaces are not the issue they were once thought to be, so we will continue with our regular cleaning and sanitizing, which is perfectly fine in terms of managing COVID. Students on the bus are spaced out as much as possible. We still ask that as many parents as possible transport. Nothing in the plan really has changed. However, due to the number of students riding, they're closer together than we would like them to be. But we don't have a solution for that. There was, in the initial reopening plan, a really hefty segment that described what hybrid and remote learning will look like. Since we really are going to be open, we don't need that section of the plan anymore, so that has been taken out. Things are changing rapidly. A couple of things I heard just today, that the approval for the Pfizer vaccine for 12 and up is likely to be out by Wednesday or Thursday. The other thing that I'm hearing is that there will be more CDC new guidelines coming out, and that's been happening pretty frequently also. So this really is a working document. I don't expect it to stay the same as the guidance changes, but I would like to the board to support it in its current state, understanding that it's a working document.
Any questions on the current document that you received? If not, I'd entertain a motion then to approve the stay open document, stay open plan as presented.
So moved.
They moved by Tim, seconded by Jim Pittman. A roll call vote, Krista?
Yes.
Julianne?
Yes.
Tim?
Yes.
Dr. Jim?
Yes.
Jim Pittman?
Yes.
Darlene?
Yes.
Dana?
Yes.
And chair votes aye as well. Excellent. Thank you.
Thank you. The next piece, general assurances, is the next item on the agenda. And general assurances are a document that a resignature and adoption by the school board is required. It's a document that must be signed by all agencies and organizations that receive federal funds through the New Hampshire Department of Education. Essentially, the assurances are confirmation that we plan to follow the federal and state laws and executive orders, the terms and conditions in the grants themselves and the timelines, that we follow non-discrimination rules, comply with federal audits, insurance, environmental regulations, adopt and follow relevant policies, and do not use any of the grant money for lobbying. And we do, the assurances is a fairly lengthy document. However, we do abide by all of the conditions in the general assurances. So.
Thank you. And I did have a copy of this over the weekend, which I did read through. It is kind of lengthy and not the most exciting thing to read through, but I did. And I initialed as board chair each page and signed the back, so I would entertain a motion to approve the general assurances as presented for fiscal year 2022. Moved by Dr. Jim. Seconded? Seconded by Dana. Okay, all those in favor. Krista?
Yes.
Julianne?
Yes.
Tim?
Yes.
Dr. Jim?
Yes.
Jim Pittman?
Yes.
Darlene?
Yes.
Dana?
Yes.
And chair votes aye as well. Thank you.
Thank you. Next is a field trip. This is our first field trip of the season. Effingham School is requesting to go to Portland, Maine for an outdoor field trip to do an outdoor trampoline park and ropes course connected to the science curriculum, and it also serves as a year-end activity. So this is just for information. I have approved the field trip because it is outdoors, and I see it as a very low-risk activity. So I just wanted the board to be aware since it is an out-of-state activity.
Okay.
Any questions on that? Okay. Another a happy event here. Ossipee Ocean State Job Lot donated a substantial amount of personal protective equipment to the Governor Wentworth Regional School District, and so I just wanted you to be aware that, and in your packet you'll see that there's a thank you letter on behalf of the Governor Wentworth Regional School Board extending our sincere gratitude for the generous donation of personal protective equipment supplies. The items will be shared with all our schools. We're divvying them up so that everybody gets a portion in our district to help keep the students and staff safe. Thank you again for the generous support of businesses like yours that make our community so special, so true. Okay. Next, Kathy, I'm going to ask you, printing, you negotiated this lease, so if you'd like to talk about it a little bit.
Yep, okay. Thank you. So this will be the fourth time we've gone out to bid with a company called SPC, which is Specialized Purchasing. SPC. If I could find. All right. So this rather large bid was for all of our copiers and printers throughout the district. The bids involved 9 other organizations, including ourselves. It was sent out to approximately 35 vendors. We're given the opportunity to bid, and we received 6 bids back. The bid that the Governor Wentworth Regional School District would recommend for the board to approve is through RICO USA. It is for the same type of manufacturer of copiers and printers, Konica Minolta. This would include the lease for the actual equipment as well as the service contract for all of the printers and copiers. This lease is a 5-year lease, and it would save the district over the 5 years $425,151.
Excellent, excellent work. I know over the years we've gone out for bid in the past and saved some money, but this is terrific work, Kathy. Thank you very much.
Thank you.
And this is an action item to, I think it is, yes,
Yes,
It's an
if you-
action item that we just added at the beginning of the meeting to approve this lease that Kathy has negotiated.
So moved.
It's been moved by Tim. Seconded by who? By who? James? Okay. I'm sorry. Okay, all in favor of accepting the proposal for the copy machine, the new copy machine lease? All those in favor? Krista?
Yes.
Julianne?
Yes.
Tim?
Yes.
Dr. Jim?
Yes.
Jim Pittman?
Yes.
Darlene?
Yes.
Dana?
Yes.
And chair votes aye. Thank you, Kathy. Wonderful job on that. Terrific, terrific work. And
Long process, but it was, the IT department helped out because it was also reconfiguring where some of the printers and copiers were going. We did cut back on the number of color printers and copiers. So it was a lot of us who helped out and took part in it, including the principals. The principals were made aware through an admin team meeting, so their buy-in whenever you cut back on the amount of printers or copiers and locations took a lot of teamwork, so it was a group effort, but thank you.
terrific, terrific job. Thank you.
Anytime we can save that kind of money, it's a great thing, so.
And everyone bought in, you know, it all takes the village to approve.
Hey,
Okay.
the legislature just, right now, the focus is on H-Bill 2, which is the governor's budget. However, there are a few things of note, and folks are going to want to go to these pieces of legislation themselves so that you can make up your own mind about whether these are things you feel should be supported or not. But the things that look like they ought to pass, H-Bill 182 requires the acceptance of high school credits from any approved program, so that would mean that the school board would need to approve. The school board would not be the body approving those credits. It would be the State Board of Education. Let's see. House Bill 71, no special meetings can be ordered by the court for collective bargaining issues. House Bill 282, all approved schools can become tuition program option for parents. It deletes the non-sectarian provisions, so it would make religious schools available on a tuition basis with public money. House Bill 388, manifest education hardship. All schools, again including religious schools, would be approved placements for manifest educational hardship. And House Bill 581, the burden of proof in special education hearings would rest with the school district. So those are the things that are on deck right now and look like they will probably pass. Good news about senior activities. Guy sent, Mr. Donnelly, the principal, sent out information to parents, I believe, last night. The activities are shaping up. Academic awards will be Thursday, May 27th at 6 p.m. in the Kingswood Arts Center. Scholarship night will be June 3rd at 6 p.m. in the Kingswood Arts Center. And these two events are invitation only, and families will receive their invite 1 or 2 weeks prior to the event. Prom is Friday, June 4th at the Gunstock Mountain Resort. Initially, the plan was for the prom to be on the Mount Washington, but the Mount Washington had to have some mechanical work done. So the students got together with Mr. Donnelly and looked at a number of different alternatives. And so they will be at the Gunstock Mountain Resort, and it's 5 to 9 p.m. Parade for seniors from their elementary school on Saturday, June 5th at 4 p.m. This ought to be a really fun event. This is the first time we will have done this, but the seniors will meet at their elementary schools in their local community at 4 p.m. They'll be escorted to Kingswood to receive their caps and gowns and a few other surprises that have been planned for them. Families are welcome to join for this event. Wolfeboro, Brookfield, Wakefield seniors will meet at Crescent Lake. in Wolfeboro, and we have a route in town for them. So the idea also is to decorate your vehicles and really make it a fun atmosphere. Baccalaureate is Sunday, June 6th, and that's going to be out on Alumni Field, and that's at 1 p.m. And this event is open to any senior and their family. It's not a mandatory event, but students will wear their gown only for the event. Seniors need to be at the back of the Arts Center no later than 12:30 on that day to be ready to go. Senior final exams, not as fun as some of the other activities. June 7th to the 9th with makeup exams on June 10th. Tuesday, June 8th is Senior Athlete Awards Night at Kingswood Arts Center at 6 p.m. The event is for senior athletes and their families. Thursday, June 10th is the Lakeside Academy graduation at the Kingswood Arts Center at 7 p.m., which is always a really wonderful event. Thursday, June 10th is mandatory graduation practice. I'm sure the students will get that information multiple times from Mr. Donnelly. And Friday, June 11th, again, mandatory graduation practice in the gym. Graduation. This is a little bit different than it has been in the past. I know we talked about this at the last board meeting. Seniors will report to the practice gym. If graduation is Friday, June 11th, that would be the first date at 6 p.m. on Alumni Field. If the weather's not looking great at that time, then we'll go to the next planned time, and that would be Saturday morning, June 12th at 10 a.m. If the weather still doesn't look good, then we go to 6 p.m. on that Saturday. So because we cannot accommodate our families inside if we have bad weather due to the current guidelines, the forecast will be looked at closely. We really don't want to have to restrict tickets. I mean, it's such an important event for families. So having the event outside will enable us to include everyone who wants to be there. So those are the activities. This will be posted on the district website. I'm sure it's posted on the school website as well. The next item is vaccinations. I spoke with the Carroll County vaccination coordinator today, and she is willing to work with us to make it easy for any family who wishes to have their child vaccinated, be vaccinated here in Governor Wentworth after school. What she is thinking about is a drive-through, which we could probably accommodate fairly easily at the Arts Center. We just had this conversation this afternoon, so I do need to coordinate with the high school principal and the middle school principal as well as the two nurses to make sure that we have all our plans covered. But the target dates would be May 27th and May 28th after school. And Victoria, the same woman who was coordinating with us for teacher vaccinations, said that any family member who is coming with a child would also be able to be vaccinated. So that would be for students 12 years old and up. So I think that's pretty exciting news, that we can make it easy for any family who wants to participate. And then, last but not least, our last day of school. Our last day of school will be June 23rd, which seems really soon. So, and that is it for the superintendent's report.
Thank you. Under the New Hampshire School Board Association, there is a major change this year in our annual delegate assembly. Ordinarily, that is the third or fourth Saturday in January. It was moved there for some specific reasons about 4 or 5, well, maybe 10 years ago, actually. And traditionally, before that, it was always held in the fall. So we're moving the delegate assembly to the third Saturday, yes, in October of this year, where the new executive board will be elected at that point. The packet for resolutions will be sent out fairly shortly. One of the advantages of moving the delegate assembly to the fall is that once the resolutions are approved, we can take those to the House and the Senate as they are working on bills that are related to that. Unfortunately, when we had our delegate assembly in January, it's already after the sessions of Congress have been set. So any of those resolutions would have to wait almost a year before we could have any effect on any of the legislation. So by moving it back to October, it's a much better process. And that just happened at our last meeting. Under Chairman's report, I do have a few expressions of sympathy that was sent out. Phil Estes on the passing of his mother, Sue Randall on the passing of her mother, and Sue McCullough on the passing of her sister. So those are expressions of sympathy that the board sent out. And on a personal note, this is Julianne's last meeting with us as a board member. He decided not to run, which is certainly not acceptable to us. But Julianne has been a terrific board member for the last eight plus years, I think it is, and certainly a valuable member on the Building and Maintenance Committee, and you will definitely be missed. And we have a little something for you for your retirement from the board. This is a district bell for your retirement. So thank you. Appreciate it. Okay, now we're going to move on to committee reports, academic affairs. Who's speaking for academic affairs? Anyone?
We had no meeting tonight,
Okay, so no report.
so no report.
Okay. Julianne, anything for building and ground? Okay. All right, I have nothing for human resources either, or finance for tonight. So we're not doing that. Never mind. Finance we talked about. Okay. Advanced planning, you can see down below, Kathy went over most of the activities that are coming up for seniors. Our next board meeting is on here. It's June, that's right, June 7th, and we traditionally do the retirement reception for our retirees, and then the school board meeting later on that evening. The retirement reception usually starts at 4, then we have a little bit of a break, and then our school board meeting on the 7th will start at 7 o'clock here at the Art Center. Okay. Okay, now we have time for public input before we go into non-public. So anyone who would like to speak, please come up to the microphone. And remember, not that we want to limit total, but 5 minutes per maximum, okay? Thank you. And please state your name and the town that you're from.
How you doing tonight? First of all, thank you for your service to the community.
Excuse me.
My name is Bob Simmons, and I live here in Wolfeboro.
Thank you.
Okay? And I'd like to request an extension on the public input to at least 30 minutes. We have quite a few, out of respect for the community members that have come here.
If the board has no objection to that, I'm fine with extending it to 30 minutes. Is the board okay with that?
Well, let's go our time period, and if we need more, we can.
Yeah, we'll see 5 minutes per, and then if we need to have more time, we'll certainly ask the board to do that, okay? Thank you.
Can we get that speaker on first?
Yeah, I think it went on that time.
Hello, Juanita Hill.
The speaker's cutting in and out, so we can't hear her.
Juanita Hill,
Okay, thank you.
Kingswood Regional High School PE physical education teacher. People have very strong opinions on mask wearing, depending in large part to the information that you are hearing or reading. It is imperative that we look at all credible information from opposing viewpoints to make the best decisions. The information that I have found and shared with the board members concludes that masks do not work, and most importantly, are unhealthy. These viewpoints have been censored, debunked, discredited, retracted, and labeled as misinformation. Their authors have suffered character assassination and been threatened. FactCheck.org uses descriptors such as right-wing conspiracy. My friends and family immediately dismiss and ignore the information without reading it. Therefore, mission accomplished. But have you fact-checked the fact-checkers? FactCheck.org has invested $1.8 billion with a B in the vaccine industry that yields a 20-to-1 return on their investment. Can they possibly be unbiased? Do you think they are more interested in telling us the truth or in protecting their investment? Where we are told not to look is exactly what we do need to see and evaluate for ourselves to determine what is in our best interest and the best interest of our children. Within 15 minutes of putting on a mask, the oxygen level of the air we breathe drops from a healthy 20.5% to a hazardous level of 17.5%. That is very simply demonstrated using an OSHA calibrator. Many of us have experienced symptoms associated with a decrease of oxygen and an increase of carbon dioxide in our blood. I personally suffered shortness of breath, headaches, insomnia, stress, trouble concentrating, and eventually lost consciousness. I have heard similar complaints from other staff and students who quietly endure their discomfort for fear of losing their jobs, being reprimanded, or getting suspended from school. I provided to the board a hypothesis, a compilation of 67 scholarly studies entitled Face Masks in the COVID-19 Era, in which the author outlines other possible adverse physiological and psychological effects that include, but are not limited to, suppression of the immune system, depression, self-contamination of bacteria trapped in the mask, dizziness, and increased likelihood of cardiopulmonary complications. The editor then retracted the article for dubious reasons, in my opinion. That retraction reinforced my belief that opposing thought is being quashed to encourage compliance through fear, thereby increasing the likelihood that people will continue wearing masks and demand the vaccine. In terms of effectiveness, Dr. Lee Merritt and Dr. Dennis Rancourt clearly demonstrate that the virus particles are smaller than the weaving of the mask materials, something like a mosquito flying through a chain link fence. Dr. Merritt further dispels the notion that the large droplets resulting from a sneeze or cough are contained by the mask. She explains that they are dispersed through the sides of the mask and that, as a surgeon, she was taught not to turn sideways to a patient since they would actually be splattered in that manner. She adds that a scientist colleague demonstrated that the virus particles travel 27 feet and insists that the 6-foot social distancing policy has no scientific basis. For those who are convinced that a mask is effective, it follows that a mask must work in both directions. That is, if a mask prevents virus particles from escaping outward, the mask should also prevent the virus from penetrating from the outside inward. Given that logic, unmasked people around you should present no danger to you. The board is consulting with medical advisors, and I can think of many questions relevant to the decision as to whether masks should be mandatory. One that is urgent, however, is this. Why is the staff at Huggins Hospital citing CDC recommendation as the reason that no medical exemptions are even considered? The CDC has been erratic and whimsical in their recommendations. They, along with the a World Health Organization, and Davos Group are currently involved in legal proceedings with over 10,000 doctors and 1,000 lawyers for crimes against humanity. One charge is that they oversaw a faulty PCR test leading to fraudulent death certificates, thereby invalidating over 90% of the alleged COVID cases. Other charges involve promotion of the experimental vaccine, whereby all 10 of the Nuremberg codes have been violated. Is it possible, once again, that the CDC is more interested in the profit margin of their financial supporters, which include J&J, Pfizer, other big pharma, laboratories, the Canadian government, Facebook, to name a few? Do they really care about us and our children? President of the school board, Jack Widmer, indicated that you would continue to watch the case rate in New Hampshire and other states in determining any change to the mask mandate. Even under the unlikely event that the PCR test is now accurate, I would argue that the severity of these cases and the confidence that treatment is available is far more relevant. 0 children under the age of 19 have died in New Hampshire due to COVID. Our kids are much more at risk of suicide, car accidents, and drug overdose, with approximately 75 deaths annually. Older adults who choose to be vaccinated have had that opportunity. It is time to change our policy to make masks optional. In the event that the board decides not to change the mandate, I am requesting publication of scientific evidence that clearly demonstrates that mask wearing prevents transmission of the COVID-19 virus and that masks have no detrimental physiological or psychological effects on the children or adults wearing them.
Okay, Juanita, you're well over the 5 minutes, and I'd like to give everyone else some time to speak, please.
I just have one more paragraph.
Okay, go ahead.
Thank you. I would finally ask the board to also explain how requiring masks for children is not in violation of Section 126U4, the state of New Hampshire, which states in part that no school shall use any physical restraint or containment technique that obstructs a child's respiratory airway or impairs the child's breathing or respiratory capacity, and no school board shall use physical restraint or containment technique that involves covering the face with anything, including soft objects, or exacerbates a child's medical condition. Thank you for your consideration.
Thank you.
Again, my name is Bob Simmons from Wolfeboro, New Hampshire. I have an article in front of me that was posted in the Patch out of New Hampshire yesterday. The headline starts, New Hampshire legislature removes state house mask mandate. Asked by a reporter if New Hampshire would be back to normal by fall, this was last week he was asked, Governor Chris Sununu said, I think we're going back to normal on Saturday. That was this past Saturday he meant. When it comes to the State House, he was a day late because the legislature had already voted to get rid of masks. The state is no longer under a mask mandate, so I'm curious why the school system still is. On Friday, the Joint Facilities Committee voted to revoke mask mandates in legislators' offices, okay? With fatalities reduced by over 95%, this is an article in the Patch, you can look it up. Since vaccination began, over 70% of our population over 65 has been vaccinated. The legislation, they can get vaccinated if they want. They're no longer asking for masks to be mandated. I know the intent of this board is to help the children. I just want to make sure you have all the proper information so that you can do what's right for the children. Thank you very much.
Thank you. Anyone else?
Good evening, Jessica Williams, Wolfeboro. I really don't have anything planned. Like I usually don't have anything planned to come speak to you tonight, but it's always somewhat passionate what comes out of my mouth. I think you can see that there are a lot of other passionate people here today, and I don't think that's going to stop as long as you continue doing what you're doing. There is no study available at all to prove that masks are safe for children who are developing their respiratory systems, their brains, their emotional systems. I live across the street, I work across the street from Carpenter School, and every single day I see little children wearing masks 6 feet apart, walking to not play on the playground. And it's sad, because there's an extremely low transmissibility of this virus in children, and there's almost 0% chance that they're going to have a terrible effect, they're going to die, they're going to do anything. They might get sick, but they're going to generally get over it pretty quickly. And I understand that you're all trying to do your best. We've heard that all along. But you've asked us to be patient. You've asked us to do the things that you've asked us to do, and we've done that. But now we're going to ask you. You have the power right now. 9 of you have the power right now to make a decision as to what happens next. I'm going to ask you to make masks optional for our children immediately. It's time. The numbers in New Hampshire are so low. If you look at the, is this working? If you look at the elderly deaths, the people that were worried about grandma and grandpa, those have flatlined and they're extremely low, thank goodness. We can always adjust later if we need to. We're going to ask you tonight to make a decision. You've had enough time. Will somebody up there please make a motion to discuss this? That's all you need to do. We'll wait. I know you've all had a long day. You've had meetings all day. I understand you're all tired, but we are tired. Who's it going to be? Dana? Tim? Charlene? Which one of you is going to speak up tonight?
This is public input, and
I know.
we're here to listen to you right now.
I know, but you're also here. We're redressing our grievances to this board as a governing body. We need to have the conversation. You've spent taxpayer money sending your attorneys, having me served with letters from your attorneys. It's time.
This is public input right now. We're listening to your...
Yes, but usually you have public input at the beginning of the meeting, and you didn't have it today. So we didn't get to bring it up. You usually have public input 1 and public input 2. You did not do that today. Why is that? Why is that not on the agenda?
I made that decision because of the lateness of the meeting, and we had other things planned. Some of it didn't materialize tonight.
You had time to go have dinner at a finance meeting or whatever, but you don't have time to have 2 public meeting sessions so we can actually have really important conversations. This board should be meeting more than once a month in these times anyway. We're still in a state of emergency, but you don't have time for a conversation?
I have a video from the head of CDC stating that it is fine for children...
Please come up to the mic if you want to speak.
I have a video from the head of the CDC, okay, where she said it's fine for kids who are outdoors playing sports not to wear masks, as long as they're not in close contact. I live by the town tennis courts, and I see these kids playing tennis every day when they go down there with masks on. It makes no sense. It's not healthy. I don't have any kids. I'm 63 years old. My kids are all grown up. But I feel terrible for these kids, you know. My kids went through this Governor Wentworth School District, and I was very happy they did. You did a great job with them. But we need to just have a conversation, to have all these non-replies. What is your opinion on mask mandates? Can you give us one right now? Please.
Well, all I would say right now as far as the mask mandates, we met last week with the 2 medical people that we've dealt with over this whole process for their professional opinions. And their professional opinion is that right now, masks are the safest way to protect our children. That's their professional opinion as doctors. All right, I'll entertain a motion to go into non-public, please. Been moved by Charlene, seconded by,
Of course, Charlene.
it doesn't
Of
make,
course.
it doesn't make any difference. If you can't be respectful, if you can't be respectful, we're going into non-public, and we'll come back to adjourn the meeting. Charlene, thank you. Seconded by Tim. All those in favor? Krista? Julianne? Tim? Dr. Jim? Jim Pittman? Charlene? Dana? Chair votes aye as well. We are now in non-public. We are going to leave this room, so if you want to stay here to watch us adjourn the meeting, we will certainly do that.